Oh, we love those stories. Well, all areas of medical care have been impacted by the pandemic, including weight loss and bariatric surgery. Joining us now is Dr. Darren Tishler, Director of Metabolic and Bariatric Surgery with Hartford Healthcare. Doctor, welcome.
Thank you.
Well, you've come up with a unique way to still engage your patients throughout the pandemic. Explain what you've been doing through social media.
Well, we had to engage our patients in a different way, and we early on recognized that our patients with obesity had problems with obesity long before COVID-19, and they'll have it after also. So we engage our patients through a variety of both telehealth visits and a social media platform through an online support group through Facebook. And we're now over almost 600 patients on our Facebook support group, and it's changed the support group being a concept of something that was once a week or once a month to something that we're able to do continuously throughout the day, all night long. Whenever someone needs a little support, they can hop onto the page.
That's wonderful. All right, and how have you been able to keep your practice going during this pandemic?
Well, we've done a lot to really help keep our patients engaged and going through to surgery. The telehealth's been a really big platform for us to be able to do that. We've been able to restart surgery recently, and the goal is that we've been able to do it in a very safe and well thought out manner.
All right, talk about some of the challenges now for patients, especially when it comes to the weight loss through the pandemic. How are they able to cope with the stress of it all while trying to maintain a healthy diet and exercise?
Well, that's one thing that we recognized early on, both for us as providers and for our patients as well, was that the stress was a major factor. And we've really worked to encourage our patients to do something every day. Getting outside, a little bit of walking. We've got good weather for the next couple of months. There's really no reason why people can't get out a little bit each day. I think it's very safe outside to practice social distancing and exercise. And the best thing people can do is walk a little bit each day. We do a weekly walk with a doc where we encourage our patients to get out there and walk with me.
Yeah, walking can be such great exercise. All right, you have an interesting study that you're conducting, the association between obesity and COVID-19 results and infection rates. Tell us about that.
Well, early on, even before COVID-19 hit in the United States, we were seeing data out of Europe and other countries that it appeared that there was a worsened effect of the disease on patients with obesity. Now, obesity itself carries a lot of other health problems that go with it, things like diabetes, high blood pressure, heart disease, and some respiratory or breathing problems. So it looks like it put people at an increased risk. Now, we're very fortunate to have a very large registry of our patients who have had COVID-19 at Hartford Healthcare, and we've been able to start looking at that data. Now, in the near future, we'll be able to report on that data, but what we want to see is there indeed an association between obesity? Is it in select populations? Is it certain patients that have a worsened effect because of obesity? But we're going to know more about it and how to plan for future infections as well.
Interesting. I will look forward to those results. And finally, really quick, just one more question. If people had been thinking about weight loss surgery, what would you say to them?
Well, like I said earlier, obesity has been around long before COVID-19. We've been able to engage with our patients and provide all of the regular aspects of the workup for surgery. So we encourage our patients that let's use this time in the pandemic to further our health and don't put off health problems. I'm very worried about people putting off serious health problems right now. And I think the next phase of harm that we could see from COVID-19 is not necessarily from the disease itself, but from people putting off taking care of important health problems.
All right. Dr. Darren Tishler, thank you very much for joining us. We appreciate it.
Thank you for having me.
Thank you.